We are in National Eating Disorder Awareness Week. The goal here to highlight the seriousness of eating disorders, address the stigma surrounding the issue, and then to offer help. Selah House is an eating disorder treatment home in Anderson. Actually, it's a beautiful facility too. It is the only place that offers residential care for eating disorders in Indiana. And joining me is Kate Fish, the Associate VP of Clinical Services for Odyssey Eating Disorder Network, which now oversees Selah House. And we're going to talk about this. I feel like this is something that we used to talk about, I thought, a lot more. Maybe even a decade ago or 15 years ago. And I think we need to talk about it again because I feel like the numbers are going up. Yeah. Do you feel that way, or you're in the middle of it all, so you probably feel like you're talking about it all the time?
I do. It definitely seems skewed to me.
Yeah.
But I think as a stigma for mental health in general goes down, we are more likely to start talking about it more, and people are more open about what's going on. So it may be on the rise, or it may be that people are just willing to talk about it more.
And we're seeing different aspects of it, especially with social media. I wanted to get right to something because I know we're going to go quickly through time. Orthorexia is on the rise, and I had never heard of it, and you were surprised. What is that?
Well, it is not an official diagnosis. It falls under otherwise specified eating disorder. It is an unhealthy obsession about clean eating and healthy food to the point where it really interrupts your life. It impairs the quality of your life and sometimes even results in nutritional deficiency.
Yeah, I think that's a big one, that nutritional deficiency. I think that is on the rise, and we don't oftentimes realize it. When it comes to the signs and symptoms overall, with where we are now, how does a parent or guardian or even someone who is, looking at this, what do they need to know?
For eating disorders in general, I think if you are noticing that your loved one or your child has a dramatic shift in weight, so maybe they've lost a lot of weight or even gained a lot of weight, I think it's so important, Angela, to remember that eating disorders come in all different shapes and sizes. So only 6% of individuals who are diagnosed with eating disorders are medically underweight, which really flies in the face, I think, of the stereotype, right, view of what we think that eating disorders really look like. So we're looking for change in behavior socially, maybe isolating more, mood changes, and then start looking towards someone's relationship with food. New food rules, maybe they're cutting out food groups even, or certain types of foods. Those can really be those beginning hallmarks of a problem.
Selah House, I want to show some of the video again because this is what we've talked about, the only place really in Indiana where you can go and stay there to be treated. What do you want us to know?
Selah House, the passion there of the individuals who work and provide that space for healing is just astounding. It is a beautiful property where healing happens in a home-like setting, and we also have an equine-based program. So the clients that are there get to participate in equine-assisted psychotherapy, which really is a special component of our program.
When should someone get help?
As soon as possible.
Okay.
As soon as possible. Really, the earlier that you can get help from a eating disorder specialist, the more likely you will have a positive outcome in recovery.
I want to ask you too something else that I don't. ARFID, ARFID.
Yes.
What is that, and why should we know what that is?
Yes. Well, it stands for Avoidant and Restrictive Food Intake Disorder, which is why we say ARFID. It's a lot shorter. It is an eating disorder, a newer eating disorder that really focuses on a nutritional deficiency and maybe aversions to food, avoidance of food, but it doesn't have that negative body image piece.
Okay.
It's a little bit different. It's found most often in children.
Oh, in children. Yes. Okay. And then lastly, before we run out of time, I know social media plays a big part in this, and I know we want to talk a little bit about that too.
Yeah. So social media just has negative impact, especially on all of our body image, right, and perceptions of what health is really supposed to look like, but especially on our young kids. And there's data out there that says even just spending a little bit of time looking at TikTok accounts, Instagram accounts, that are under the guise of wellness, right, negatively impact how they see themselves and how they see their body and their relationship with food.
People like you are there to help. I know we need a lot more folks to go into the field to be a clinician. If you would like to know more information, connect to Selah House at fox59.com/links. We'll link you up there, and to the Department of Health and Human Services to learn more about National Eating Disorder Awareness Week. Maybe we can have you come back and talk about the importance of, looking at this maybe as a profession because we need more people like you. Good to see you.
Thank you.
Yeah, absolutely.